Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I am joined by a special guest, Meredith. Meredith, please introduce yourself.
Hi, Cole. Thank you so much for having me. My name is Meredith Steinfeldt. I work at Nicklaus Children's Health System down in Miami, Florida as an administrative fellow. And I have a background in public health. So I got my Master of Public Health degree from Tufts University, School of Medicine, about a year ago.
And congratulations on getting that degree. I believe your concentration was in biostatistics and epidemiology, right?
Yes, I was really interested in biostatistics coming out of undergrad. I got my bachelor's in sociology with a minor in biology and had a little bit of a background in biostatistics from Hobart and William Smith colleges. I graduated in 2020 in the height of the pandemic. I knew that I was interested in pursuing a graduate degree, but I didn't really know where it would take me. I ended up finding Tufts program with the concentration in biostatistics and ended up going there, and the rest is history.
Back at Hobart and William Smith, you were also a evolutionary biology researcher, right?
Yes. So the summer after my first year, I was interested in staying on campus and doing research. I knew that I wanted to pursue a pre med track. So I actually went through all of the prereqs for medical school through undergrad. I knew that I wanted to work in healthcare, but I wasn't exactly sure what that path would look like for me. I knew that I wanted to do research from the very start in undergrad. So I took an intro to biology course during my first year of college. I had a great relationship with my professor and ended up staying on campus that summer and doing a research study on Asclepias syriaca, otherwise known as the common milkweed. It was a great summer.
I love my time in the evolutionary bioinformatics lab. So when I see people who've done evolutionary biology research, I just love to have a brief chat about it because it's
Yeah.
really an interesting experience. They kind of just throw you right into it. It's an awesome place to get some of that kind of experience working with professionals. So that's awesome. What made you get that MPH instead of going into med school? What did that transition look like for you?
Yeah, so I grew up outside of Boston, probably an hour away, and so I was very familiar with the city. I used to beg for my parents to take me to Boston on the weekends, on my birthday. That's all I wanted to do. But ironically, moved away for college, and then when I was doing my online coursework in the MPH program at Tufts, I wasn't in Boston. So I ended up moving after undergrad to Rochester, New York, which is around 45 minutes away from Hobart and William Smith colleges. And then I stayed there when I was doing my MPH, my online MPH. And that was one of the reasons why I was so interested in the program to begin with, because it meant that I didn't have to move during the pandemic. And the future was uncertain. So I just wanted to make sure that I didn't have to move to a new city and that I could stay where I was. And so it was very convenient. And it was also great because it allowed me to engage with people from all over the world in my classes. I did all of the prereqs for medical school throughout college. Around the summer, going into my junior year, I started becoming very passionate about social justice. I had taken a few sociology courses and actually, going into college, I was a biochem major. So I was really immersed in all of the sciences, but I was a minor in sociology at the time. I had never really heard of sociology. I didn't know what it was, but I started taking more classes and becoming more passionate about social justice my freshman and sophomore year. And then the summer going into my junior year, I decided to switch. So I became a sociology major with a biology minor. And my senior year, I ended up doing an honors study on masculinities and social justice and sexual violence prevention on college campuses. And so I think part of it was being so passionate about social justice and wanting to continue to pursue some of the topics that I had learned about and been introduced to as a sociology major. and also knowing that I wanted to continue on in healthcare. And I didn't know exactly what that path would look like for me, but I knew that I was interested in biostatistics. And it was also the second part of this is it was the height of the pandemic. So I actually didn't have a graduation ceremony at the end of college. I was part of the class that went to spring break and then got a letter, at the end of spring break saying, don't come back and stay home. And so I didn't really know what the future held at that time. I knew what I didn't want to do was move across the country and go to medical school and start off in a new city when I didn't even know when the pandemic would end or if it would end and what the future really held. So I knew that I wanted to take a bit of a break. I spent the summer deciding what the next steps would be, and then I happened upon Tufts online MPH program, and it was my path forward. So I saw that they had a biostatistics and epidemiology concentration. It seemed like it would be the perfect marriage of sociology and social justice and healthcare. I found that program and I never looked back.
What's great about that online program, though, right, is that a lot of times when people think of online programs, it's like you're going to be like isolated and, but you were doing lots of things with Tufts at the same time, right? You had 3 or 4 positions that you had kind of worked with the quality improvement side, research assistants. So, how was that integration? Did you feel like you were part of the Tufts community?
So, and that was actually one of the things I was most nervous about going into an online program. However, being part of that graduating class that graduated during the pandemic, I had a little bit of an intro into what it would be like to learn online because from spring break forward until graduation and undergrad, I was taking all of my classes online. So that made me a lot more comfortable knowing I know how to use Zoom, I know how to use Teams, and no matter what, I'll be successful taking classes online. I think if the pandemic hadn't happened and I hadn't sort of gotten that intro into, Zoom world and learning online, I may not have felt as comfortable, but once I started at Tufts, I made lots of friends. I was able to establish relationships with all of my professors. A lot of our classes actually started 15 minutes early, so the Zoom room would open up before class. And I would say that was really how I started forming those relationships because I'm one of those people that likes to join early and start a conversation and learn about the people that I'm learning with and the faculty. And so I would always join 15 minutes early and stay 15 minutes late. And it was those conversations that I had before and after class that really helped me start to form those meaningful relationships and opened up other opportunities outside of the classroom. So I was able to form those relationships. And anytime I was taking a class that I had a particular interest in the topics and wanted to gain hands-on experience in, I would make that known to the professor and ask for opportunities to do extra assignments or get extra experience in the topics. I was really able to work for the American Public Health Association, work at Tufts Medical Center, become a teaching assistant and a research assistant. It was really by just having conversations and expressing interest because the faculty at Tufts are all professionals outside, for the most part, professionals outside of being a professor. So many of them work at organizations like Tufts Medical Center, the CDC, the FDA, all sorts of great organizations across the country and around the world. And so, they have a lot of resources and it's a great opportunity to gain experience outside of the classroom.
So, good advice as well for the faculty of other organizations on how to foster that community with an online program is creating that opportunity before and after. I really like that. So, you're really integrated in this program. You did, of course, excellent. You graduated with the perfect, GPA there. And so, you've done really well in the public health arena. And then, of course, you're a member of the American Public Health Association. I'm a big fan of them as well. And so, then this fellowship path presents itself. You didn't end up going on to be an epidemiologist or to get a PhD like a lot of our MPH colleagues do, but you took this administrative fellowship route. How did that come up? I kind of want to understand how you actually got introduced to that idea, at what stage of your MPH program, and then what made you choose that route.
This is another kind of funny story, but I grew up thinking I was going to go to medical school. I went into college pre med, and I just expected life would be this, clear path. But it ended up being, kind of twisty and turny. And this is another example of that. So I go into Tufts, into my MPH program, thinking that I'm going to be an epidemiologist or a biostatistician. And then the first term of my MPH program, I take an elective course. And it's sort of a crash course in an MBA. That's how it's
Mhm.
marketed. So you learn basic negotiation skills, financial accounting, and I actually fell in love with the curriculum. And it was kind of jarring to me because I was worried that I was in the wrong program. I remember vividly having a conversation after class, one of those 15-minute, after class conversations with my professor and saying, I really love the work that I'm doing. I find myself at the end of the day when I shouldn't be doing any work, when it's just my time to unwind, doing your cases. I'm enjoying the work so much and it's just exciting to me.
Mhm.
And am I in the wrong program? Should I, I was in the first term of my MPH program, should I be in an MBA program? And he said, you're doing fine. Stay where you are. If you're still interested in this material at the end of your program or in a year or so, then reach out to me. Because at the time, this was Professor Mark Haas. He was the executive director of medicine at Tufts Medical Center. And so at Tufts, you have a practicum experience at the very end. And so it's usually an applied learning experience, is what ALE stands for. And all students have to complete their ALE. And it's a term, a 1 semester long practicum opportunity, and then present your findings and the project that you did. And he said, if you're serious about this material and you would like to gain hands on experience, reach out to me when you're ready and we'll see if there's any project opportunities available. So I'm one of those people that doesn't forget things. And when I'm really interested in something, I'll write it down and I'll just remember. And so a year goes by and I'm still thinking about
Mhm.
this MBA crash course class and excited to reach out to him. So I emailed him. I said, I've gotten these experiences during my MPH program. I was a research assistant and I worked with the Men's Health Caucus at the APHA, and I've maintained my GPA, and I would really love to work for you. And he reached back out and he said, I have a quality improvement project that's starting up soon. If you're interested, let me know and we can work together. And so I ended up doing my ALE with him. And then at the end of the ALE, I said, what now? I'm finishing my MPH soon. I am done with this ALE and want to continue working on these topics. I'm still interested in finance, but like I said, the MPH program, that was an elective course in my first term. So I didn't have much experience in finance or strategy. And so, how do I continue to gain experience in those areas? And Professor Haas was the one who said, if you continue to be serious about these topics and want to gain more experience, there's something called an administrative fellowship program, and you should really look into it. They're very competitive, but if you are still interested, then apply to a few and see if you get one, and then pursue that path because this will expose you not only to finance and to strategy, but you'll continue to gain experience in quality improvement. I knew that I was interested in that. And I also was still interested in, community engagement and public health and epidemiology and data analytics. So I felt like it was the perfect opportunity to continue to explore lots of different topics and not, avoid pigeonholing myself in one of them because I knew that I wasn't ready to really make the commitment yet to one of those fields.
Actually, very inspiring. I'm sure we're probably going to use some of that answer for our shorts on Instagram as well, because it's very inspiring. Let's go back for a minute, though. Why, it's funny because I'm sure maybe you did this. I know we did. During my biology major, we made fun of the business majors, right? Because the courses are like, we always said they were comically easy. And I'm sure the business majors made fun of us. Later, of course, I became a business major in undergrad as well. And so, what did you like about that? those business courses? What particularly were you doing that you said, wow, this is really cool?
I think for me, it was being able to work with numbers in a different way,
Mm-hmm.
possibly. I mean, I was used to working with numbers and data analytics for biostatistics. So all my six courses, I learned how to code and to work in data, and that was really interesting to me. But I think that working with numbers in a different way was kind of exciting. And also being able to do cases and apply some of the things that I was learning to real world scenarios. So we used a lot of Harvard Business Review case studies, and I think that was really exciting. And I think part of me has always wanted to work in healthcare administration and not necessarily known the words to use healthcare administration because that was never something that I had been exposed to. So I didn't really know that healthcare administration was a thing. The first glimpse that I had into healthcare admin, case studies where I have to open an urgent care center in a mall and doing the analysis on is this going to be profitable? It gave me some insight into the topics that I would be learning about if I were working in as an admin fellow in healthcare admin. And so I think maybe part of me knew that was my path and that, it was just really exciting to me. But I also love negotiating, and we had a few exercises where I got to do negotiations and just apply the things that I was learning about. And I think that was always really exciting for me.
I think you gave a good answer for sure. I love our MPH research colleagues so much. I think they're incredible people. And one of the issues I know that some of them struggle with is, okay, you have this way of solving a problem, but it's kind of in a vacuum sometimes where finances don't always play into it. And so some of the most powerful people I've seen are the people who have that MPH background, but also have that business background. And then they're able to translate these hugely impactful social projects into something that could actually be profitable or at least have supporting revenue. And I've seen that a few times at our institution. So I think it's an incredibly powerful combination where you're able to translate things into that financial backing. One of the big questions I have for you is, why did you choose the fellowship program that you did down in Florida, especially as a Northeasterner like myself? What was that like? And please tell us about the program that you chose.
Yeah. So as I said before, I'm at Nicklaus Children's Health System in Miami. I had always wanted to live somewhere a bit warmer. So I'll just be very upfront and transparent. I was always interested in living in at this part of the country, but I started out really by looking at the different types of programs and the different models that were offered because not all fellowships are equal. I think that there are a lot of things that you need to consider if you're interested in one. So there are some fellowship programs that are rotational based and some that are project based. And I knew that I wanted a bit of both. So I wanted to, and there are also semi structured rotations and then very rigid structured rotations where you'll start and you'll be in finance for 2 months and then strategy for 2 months, quality for 2 months. And every fellow, does sort of the same thing and goes through that cycle. I knew that I wanted a little bit more flexibility from my fellowship program. And Nicholas really allows the fellow to sort of make their own path and tailor it to their own interests. So that was the first sort of thing that stood out to me about Nicholas Children's that made me interested in the program. I also knew that Nicholas had one fellow at the time. We're actually growing our program. So this July, we'll be joined by two administrative fellows. It'll be our first multi fellow cohort. So, super excited about that. But when I was looking at administrative fellowship programs, I knew that I wanted to be a part of a program that gave me a lot of great exposure to executive leadership. And at Nicklaus Children's, the fellow is really treated as part of the executive leadership team. So we work in the C suite, we report directly to the CEO, Matt Love, and we gain a lot of exposure. We sit in all of the board meetings, we go to executive leadership team meetings, and we gain a lot of insight into the way that leaders work and the way that their minds work and how they make certain decisions. I think that was also something that stood out to me because I ended up going through the first phone call interview, and then the second round interview was with leaders, director level leaders, VPs, fellows. And then the third round was in person. And I actually interviewed with the CEO, with the president of the hospital, Perry Ann Reed, and the chief of staff, Dr. McCafferty. And so I think that interviewing in person and seeing the level of investment that the executive leadership team had made in the fellowship program was something that stood out to me as well. And then also being a pediatric health system. So the culture is really different at Nicklaus Children's, and it sounds kind of cheesy, but it's the truth. So, I interviewed in person at a few different hospitals and health systems. Nicklaus Children's was the only one that I interviewed in person that was a children's health system.
Mhm.
And I really felt the difference. So it's not a super corporate environment. Even though I'm working in the C suite, I'm still surrounded by people who want to work with children and better, the patients and the families' lives. And the things that we do on our campus are just different. It attracts a different type of person, I think, and personalities. And so, we are healthcare administrators, but at the end of the day, we just do things a bit differently, and you feel that. So people come to work very happy, and like you get off the elevator and you're surrounded by people on a Monday morning and everyone's smiling and excited to go to work. It's the only hospital that I can walk around in and I see clowns like walking by
Mhm.
me and dogs running around. It's just a nice feel.
That they really like the environment more than they even expected to.
I think that being at Nicklaus Children's and having experienced it, I don't know that I could actually go into the adult world. I think it'd probably be easy to do the reverse and to work at an adult health system and then go into peds. But I don't know that I could do the reverse at this point because it's such a nice environment to work in, even though I might be staring at a computer screen doing, an analysis all day. At the end of the day, I know that I'm making the lives of children better. And even though my work might not be directly related to patient care downstream, I am having that impact. And it's something that every large meeting we have at Nicklaus Children's, we start our meetings with a mission moment.
Hmm.
And so we start with a video of a patient and their story, and it ties it back to the care that we're providing. And so I think that also is very fulfilling to see the impact that I'm having as a fellow, even though I might not be working with patients in my day to day.
It sounds like an incredible place to work. Congratulations on finding such an amazing place. I want to ask, how many programs did you apply to initially?
That's a great question. So I think probably around a dozen. I don't have the exact number off the top of my head.
That seems like a good average.
Yeah, I would say probably around a dozen. I knew that the administrative fellowship track was extremely competitive. And, I've always been a type A personality, worked hard and pushed myself, but I knew that everyone else that was applying was the same way. And so I knew that I needed to give myself options, and it kind of felt like a good number. I've met fellows who have applied to two, to one, and
So
they got it and it worked well for them. But I treated it like, it sounds silly, but I treated it a bit like college applications in a
mhm.
way. I know that there are some people that apply to one college and they get in and it's okay and it works out, but I used NAFCUS, the sort of like common app for administrative fellowship applications, and did it that way, and it made it very simple and streamlined, and it worked out.
I'm really happy that it worked out. I think that's excellent. It seems like you're extremely happy there. So that's wonderful. And how long is that? Is it a 1 year or 2 year fellowship?
Another good question. um, it's a 12-month fellowship program, which is kind of flexible at the same time. So if you decide to transition into a full-time role early, then that is an option, but it's designed to be a 12-month program. And I started in June. I believe my end date is around June. I started June 26th, and that's around the end date. Sorry. Our next fellows are starting in the beginning of July.
Oh, nice. So you'll be as well. This is the big question: is then what are you doing next? Where are you going to be in July?
I will be at Nicklaus Children's Health System. I've really enjoyed my program. I've made a lot of very meaningful relationships with all of our leaders. I've really immersed myself in every aspect of our health system. And I think if you know me, you'll hear me saying this a lot at Nicklaus Children's. The most important part of the administrative fellowship program is the relationships that you build, in my opinion. So I've done lots of projects, and going into it, I thought that would be the most valuable aspect of it, would be the experience I would gain. But at the end of the day, it really is the relationships that I've built. And
Mm.
so, I could take that elsewhere and maintain those relationships, but I think it would be a lot more difficult. And I really don't want to leave that behind. So I'll be staying at Nicklaus Children's and, excited to see what these next few years bring.
Because that's one of the first people you met, right, at the beginning.
I am excited to continue on with those same relationships that I've built throughout my fellowship program, to continue working with the same people and learning from them, because I'm at the start of my career. I'm fresh out of graduate school. I think that it's important to continue maintaining those relationships and learning from people who have so much great experience to offer and to learn from.
So, kind of an extracurricular question for you, for all of the people who are probably going to be so interested in coming to the Miami area for their fellowship. What is the Miami area like? We know that it's been increasing in the cost of living there as lots of people have been moving. Urban development has been going really well in Miami. For the administrative fellows, is this a city where you have to have a roommate, where you have your own apartment, where you rent your own house? Is it an urban area? What does that really look like for the fellows?
I think that really depends on the individual. I did move down here with a partner, so I was able to split rent, which was really nice. I have friends that live with roommates and friends that live alone, and I think that there are affordable places if you're just willing to hunt for them and to put in the time. So I live relatively close to the hospital, which is really nice, especially because of Miami traffic. Nicklaus Children's Hospital is located in the Coral Gables area. It's actually a pretty residential area, which is another reason. I forgot to mention this when I was answering why Nicklaus Children's, but another aspect that I really loved about the hospital when I visited, I had really never been to Miami before when I came down for my in person interview. I still remember I pulled up in an Uber right into the hospital, and I remember thinking, where is this hospital at first? Because we were pulling into the neighborhood and it's surrounded by residential homes, and it's in the middle of a little neighborhood. And it's very well hidden, honestly. So I was pulling up, I saw we were only a few minutes away, and I still didn't see the hospital. After my interviews, I walked out of the hospital and I walked around the neighborhood, and it was very nice just to know that there were sidewalks and it was very walkable. So often on my lunch, I'll just walk around the neighborhood, and it's just a really nice area and place to live. So I'm lucky that I don't live too far, and it is a very nice area. I think a lot of people think of Miami as very city, lots of urban sky rises and nightlife and hustle and bustle, like a mini New York City, which there are areas that are like that. Brickell is a really popular area for people to live, and people do refer to it as a mini New York City. But then we have Coral Gables, which is closer to the hospital, which is more residential, lots of outdoor shopping outlets and
Mhm.
restaurants. And then, Coconut Grove, which is pretty close by as well. So I would say those are probably the most popular areas for people to live close to Nicklaus Children's. So we have more residential, and if you want to get in on the action and go into Brickell and be a part of the city lifestyle, then that's an option too. But I would say, as someone who's lived here for around a year, it pays to live close to the hospital because the traffic is real. And so, I can get up in the morning and be at the hospital within a half an hour from waking up and getting ready to being in at my desk. And I know some people who are in the car for an hour and a half. So, you know,
Absolutely.
trade off.
Well, it sounds like an awesome place to live. Big difference, of course, from the Northeast corridor, for sure, from what it sounds like. So that's wonderful. I'm so happy you found such a nice place. And I hope that a lot of our future fellows are going to see this and consider applying. So I really do appreciate you coming on and talking with us. And hopefully we can stay in touch.
Thanks so much, Cole, for having me. It was a pleasure.